Mr. Kabra. Dr. Kabra, I shall say, welcome to the Oncology Summit 2025. We have a few questions for you. How do you see the integration of mental health, nutrition, and survivor counseling influencing cancer treatment outcomes among Indian patients today?
So it's not only true for Indian patients, it is true universally that we must have mental health, nutrition counseling, psychological counseling incorporated into oncology care, because that not only helps in prevention of cancers, but it also helps in recovery from cancers and decreasing the chances of reoccurrence. Now, there are ample studies which have shown that a better mental state, better immunity leads to better recovery and lesser recurrences from cancer.
So, cancer treatment is financially tolling for a lot of families in this country. What steps do you recommend can be taken to help out those families or to end that disparity between treatment demands and treatment needs? How can we do that?
There are few steps which must be taken. We keep on talking about healthcare being outsourced to private players, which is not true. Not true means which is not right. It's true, but not right. Ideally, we should have capacity building within government hospitals, at district hospitals, to provide oncology care so that it is more accessible as well as more affording for people. The second part is wider coverage of insurance in our country. And the third part is how can we make the treatment less expensive. So we did have a panel discussion, and one of the panelists very rightly said that we should have indigenous technologies which are cheaper, at good quality. We should have our own research and development of our own drugs or manufacturing of our own drugs so that we can decrease the treatment cost.
One last question to you. What is the next generation of cancer treatment going to be? What are the innovations we can expect in terms of infra, in terms of technology, in terms of skills in doctors? What is the next thing that is coming?
So I'll divide that into various fields because there are three broad fields: surgical, radiation, and medical oncology. And I will add an element of preventive oncology also to it. So I did speak about prevention, that preventive oncology today, lifestyle is the cause for 60 to 65% of all cancers. So there is a very big scope of prevention, but that will not come from hospitals. It has to start in public, in community, and it has to start at a very early age from schools. We have to incorporate that in the curriculum so that children are exposed to it, and in turn their parents also get exposed to it, because when they learn, they will go home and talk about it. If I talk of technologies, so I am a surgeon, I'll talk first about surgery. We are moving towards more and more minimally invasive surgery, robotic surgery, AI driven protocols, which has already come up in a big way and is going to increase further. Having said that, we must realize that robotic surgery does not give you an advantage of cancer outcome. It does give you an advantage of smaller scars, faster recovery, but the cancer outcomes as of now, as of today, are the same. Also, now we have a Indian made robo which is at probably one third to half the cost. They haven't yet disclosed, but it is going to come at that cost. For medical oncology, there is immunotherapy, there are targeted therapies, and there are combination of targets with chemotherapy. So it's a very fascinating time that we are in right now, and we are expecting oncology care to become more and more personalized going forward. And in radiation oncology, there was a time when there were just cobalt machines which would radiate all the tissues equally, almost equally. So good amount of side effects were there. And then came further technologies. Now we are concentrating to the tumor area and just beyond it, so that we cover a certain margin around the tumor without affecting or minimally affecting the surrounding organs. And that is what is the progress in radiation oncology, already happened and is going to happen further.
Thank you so much for your time. So it was lovely talking.